Stay tuned to discover the healing effects of Rezzimax for chronic pain. Hi there, I'm Dr. Krista Burns, founder of the American Posture Institute and your host of the Pain Summit. The Pain Summit is dedicated to empowering you with the knowledge, hope, and proven solutions to overcome chronic pain. I'm honored to welcome our next guest expert. Sharik Peck, physical therapist, created Rezzimax tools and techniques to help you eliminate pain and improve performance. The Pain Tuner Pro is a result of over 15 years of research and development and has been awarded 3 US patents and 1 China patent. Today he'll be sharing with us vagus efficiency, controller of pain and inflammation. Sharik, thank you so much for joining us as a speaker on the Pain Summit. Please take it away.
Understand a little bit more about vagus nerve efficiency and how to control pain and inflammation through one major, absolutely perfect system in the body. I want to start though with showing a little slide about myself. Here is an image of my neck. And as you can see, there are some deficiencies. You can see the ear holes line up, and so I'm straight up there. But as you can see, C1 does not sit on top of C2. That's what happens when you're a little child and the neighborhood kids are spinning you around and they let go. And your head lands up on the sidewalk and your body down in the curb or in the gutter. And it fractured off my odontoid process. This, as you know from a posture expert, this creates quite a bit of instability that I've had to deal with all my life. It's given me some understanding that I think has helped me in the chronic pain arena, because I've constantly got all the tension in the jaw and the cervical muscles trying to hold my head together. But I wondered what your thoughts are from a posture expert on how do you help somebody that can't stabilize all of those joints and muscles?
You know what? I'm so glad you asked this question, and thank you so much for sharing this visual with us. The first thing that comes to my mind is the importance of taking a picture of what's happening beneath the skin. So posture is, not just skin deep, but we want to see what's happening below the surface as well. And then recognizing how innately wise our body is that we're going to compensate. So likely because there's lack of stability right there at the cervical spine, you're stabilizing with extra musculature, pulling in particular directions to keep those eyes parallel with the horizon. Now, one of the things that we recommend at the American Posture Institute is we love having brain activation, actually changing how the brain perceives our uprightness of posture relative to gravity. So it's not just going to be about activating and stretching muscles, especially in this case, but it's actually going to be about retraining the brain and how it resists gravity. So we like to do things like working with the eyes, doing some eye training, working with the vestibular system, working directly with the brainstem activation. And those are really great ways to help improve posture, especially with, a case like yours, which again, thank you so much for sharing with us.
Chris, that's a beautiful response, and that really is the impetus for everything that we have created. I've been a physical therapist for over 32 years now, and the excitement that I have in helping retrain a person, retrain their brain to be able to function with whatever anatomical limitations they have, that is the reason why we have created a lot of the tools and a lot of the techniques that people are going to understand in the next few minutes. So I need to give just a little bit of a background. When we talk about cranial nerves, these are the nerves that go straight into the brainstem, straight into they don't have to go through the spinal cord. And they take messages straight in that help the nervous system and the brain get its cueing about everything that's going on in the environment, everything that's going on in the body. It's where a lot of the messaging is taken in and also sent back out. And in the cranial nerves, there are two powerhouses. Now, obviously, the eyes and the smelling system and everything related to the tongue, those are all important. But there are two powerhouses that I play with mostly. One is the trigeminal nerve, which is all about the clenching, the fight or flight response. There's so much involved in that trigeminal nerve. And the other nerve would be cranial nerve 10, or the vagus nerve. And in my world, those two are opposites on the playing teeter-totter. When one is up and functioning really well, the other one cannot function very well. And they don't play good together. It's either one is up and one is down. They're opposites in how they function. And with that background, I want to share just a little bit more about what that vagus nerve, cranial nerve 10, does for a person. There's an excellent image of it to the far right of my screen, made by my friend Kathy Duvall, and it shows the everything that nerve goes to. I mean, it goes to your pineal gland, your pituitary gland, your hearing, your inner ear. It goes to your tongue. It goes to your or goes to everything down below this head level, all the way down to below the belt level. And it coordinates the communication with absolutely every system there. And these are a few of the things that it controls. It modulates inflammation, which is so important for so many of us, strengthens memory, helps you breathe, it increases salivation, it controls the relaxation response, and it inhibits depression. Now, some people say, well, how does it do all of those things? But it is the system that tells your body to produce serotonin and tells it how to use it. And there's a lot more information coming to the brain than going from the brain to tell the body how to regulate these systems. So in essence, it's got its feelers out all the time, assessing what's happening and then taking messages down to tell the body what it needs to produce. Visceral, meaning the organs, it takes all the information from those organs and sends it up to the brain, the limbic system, the emotional system. So essentially, our gut brain is controlled by the vagus nerve. It sends all that information up to the brain, and it has a role in attention, emotion, and anxiety. So it's super important and a bit complex, but just a couple of things that help us out is there's this part of the vagus nerve that is more of the ancient part, the dorsal vagus system, and we share that same system with a lot of other animals. What we humans have that is quite remarkable is a much more advanced ventral vagal system that includes how it regulates heart rate and how it regulates breathing. And part of that ventral vagal system that is absolutely fascinating for me regulates heart rhythm. Let's see, regulates stomach acid, but your vocal cords are a direct branch of the vagus nerve. It's called the recurrent laryngeal branch of the vagus nerve. That is why when you see the monks humming or chanting, or you see people using yoga techniques, it is because of that branch of the vagus nerve that is so tied in to vocalization and harmonics that we see people be able to benefit from vagus nerve therapy of this particular kind. Now, here's a short list of some of the things that we have developed treatments for, and they're in various stages of research and study. I'll share one of our protocols in just a few minutes on a study that is to be published next month in the journal Oral and Facial Pain and Headache. And yes, you guessed it, it is on headaches. But these are some of the conditions that we treat. You ask about who are some of the people that use our tools. Probably the most important one on my list are moms and dads that use it for everything from pain conditions and sports-related issues to helping their child with nonverbal autism begin to start speaking, because we essentially are helping organize their brain and their brainstem so that they can start functioning better. Along the way, we treat CRPS and all kinds of other conditions, but athletic trainers are using it, foot zone professionals, medical doctors, midwives, chiropractic physicians, physical therapists, acupuncturists, psychologists, nurses, dentists, reflexologists, naturopaths. I think we've got just about everybody on both sides of the aisle, both the Eastern and the Western medicine that are using our tool, and it's been so fun to see. Let's just show you a little bit more. This is what it looks like. These are a few of the basics, you might say. And every one of these has a very distinct anatomical connection as to why they work and how they work. We essentially use vibration that's calibrated with the purring range of a common cat. We found that purring is so helpful for humans and animals, and it speeds up stem cell activity. It speeds up bone healing by 66%. That vibrational frequency range is very powerful. So we just calibrated that. We actually split it into about 3,000 points, if you will, like notes on a scale, and we shoot those back into the human nervous system through acupuncture points. If you look at image number 1, for example, we're just using the suboccipital muscles, which are powerful messengers to the brain. They have a connection to the brain that's very unique. Those rectus, captus, posterior, minor, and major muscles have a myodural bridge. The muscle, myo, and the dura, meaning the covering over the brain, have a connection there that tells the body when it's in a stress response to lock up the upper cervical region. We take advantage of that information to be able to activate the vagus nerve through points like the suboccipital muscles there at the back of the head. We also use, like in number 2 there, we use the supraorbital branch of the trigeminal nerve as a perfect spot. Yes, I know acupuncturists have used this for centuries and millennia, but we use it as a point to calm down the other branches of the trigeminal system, allowing the vagus nerve efficiency to improve. Anyway, all of these techniques that you can see here, all of them have been developed in such a way that we just have a way of talking with the central nervous system and calming it down. We've made it even easier. If you go to our website, Rezzimax.com, you'll find all kinds of videos for how these techniques work and what kinds of conditions you can expect to see benefits from. Then we've taken it a little bit further. And when I say here, if you put these techniques with a very simple concept, it's called humming. Direct engagement of the vagus nerve. As we have a person hum while using the device, it creates a meshing of vocal harmonics and machine harmonics, and it creates a calming song that the nervous system responds from. And we use pressure points from the feet all the way up. But guess what the greatest chemical changer is? It's what you think about while you're doing these therapies. If you think about things that you're grateful for, your heart puts out oxytocin, and it puts out chemicals that put the nervous system into a healing state. And if you think about, the big wreck that you're likely to have on your way to work, that you crash all those chemicals of healing and health. And so we teach people while using our device simply to think about things they're grateful for while humming, while slowing down their breathing, and it gets their nervous system into a great, great state. Anyway, we have videos on all of those techniques, COVID long haul techniques. We've got some intraoral techniques, and a lot of those you can find right on our website. I'm now going to share with you a headache study protocol. This is the study that's just about to be published in about when your seminar, or about when your the whole thing is launching next month. This should be in black and white print. So here's the protocol.
The Rezzimax Tuner Pro 2 was recently part of a research study to evaluate its efficacy in treating headaches. Today, we're going to share the protocol and techniques used in this study. Each participant in the study received the following instructions. Place your tongue between your teeth. This helps to unclench your jaw. Hum gently along with the resonance of the Tuner Pro 2. This helps your vagus nerve to magnify the positive effects. There are 4 modes, blue, green, red, and white, that change to the next by pressing the button between the 2 arrows. For the purpose of this study, the algorithm or program modes will not be used. For these exercises, you'll need your Rezzimax tuner and accessory tongs. The Rezzimax neck pillow and disposable gloves will make things easier and more enjoyable if you have them available. Step 1. Attach your accessory tongs to the tuner. Choose a level that's comfortable between 5 and 10. Place the tongs on both sides of the neck, with the tuner resting against the spine. Hold the tuner in place with your head. Slowly, rotate your head from side to side, keeping pressure against the tuner. Keep the tuner in place for 2 minutes. For extra support, you can place the Rezzimax neck pillow behind your tuner. Step 2. Use intensity level 6 or lower if needed. Gently contact the tongs at the center of each eyebrow. Keep the tuner in place for 2 minutes. Step 3. For each of the steps, choose an intensity level that feels comfortable. With a gentle amount of contact, place the tongs close together between the eyes at the top of the nose towards your forehead. Keep the tuner in place for 2 minutes. Step 4. Increase the intensity up to level 10 or as high as you're able to tolerate. With a gentle amount of contact, place the tongs under the jaw, holding the tuner with both hands. Keep the tuner in place for 2 minutes. Step 5. In this step, you'll be placing the Rezzimax tongs inside your mouth. You can slide a disposable glove over the accessory tongs for easy cleanup. Increase the intensity up to level 10 or as high as you're able to tolerate. Now you're ready to place the tongs inside your mouth. Make sure that each tong is placed between your cheek and teeth. Angle the Rezzimax tuner up and down. Sweep the tuner side to side for 1 minute, then slowly open and close your mouth for 1 more minute. Choose a level that's comfortable between 5 and 10. Let's get down and set the tuner on the floor in front of your seat. Using a moderate amount of pressure, squeeze the tongs with the instep of your feet and rest your big toes on the wings. Keep your feet in this position for about 2 minutes. Thanks for joining us today.
So the cool thing about that process is that it's pretty easy to implement a protocol that we've already put together and seen the effects with. This was our headache study. We've actually completed another double-blind placebo-controlled trial on dysmenorrhea, going for the other end of the vagus nerve. And we're under trial with one more study right now looking at TMJD, temporal mandibular joint dysfunction, and techniques in dental practice. A few more techniques, and I'll just show you these briefly. As I said, we've got videos on all of these techniques. Now, you might be wondering, what do I do if I don't have this cool little tool that Rezzimax invented? We'll take anything that vibrates, and you can get those off of any store shelf, and they're going to be somewhat helpful. They're not calibrated at the same level as our device. They don't have these cool wings, which we use for stimulating the nervous system. But that's where I started. I went through more than 12,000 of these devices in different stages before we ever created our own. We created our own because we couldn't find the exact right vibration levels, and we couldn't get consistent energy out of the devices. But that's where we started, and we could get some great effect for all of our patients. As you'll see, that we do a lot with the scraping. This is a technique based on an ancient concept called gua sha, and you'll see it all throughout Asia. But that scraping technique has a way of helping the body reestablish the body map. And all of these techniques, in fact, are techniques for peripheral neuropathy and such, are just phenomenal for almost instantaneously waking up the body and its connections. And we now have evidence. We have people who have done these techniques for long enough that they've been able to show their nerve conduction studies go from in the red zone to up in the green zone. So they're improving their functioning. We've also got individuals that have been using it for all kinds of conditions that you would never expect a benefit from, such as severe tinnitus, and we're being able to help them turn those off and get back to full functioning. Just a little bit about primitive reflexes. We do a lot of this in adults and in children, but this is the work especially that helps an autistic child or a child with ADHD learn how to get their body functioning well again. They have to first understand where all the body parts are, and this process that we have found helps tremendously, but you need to understand a little bit about primitive reflexes. We've got a section on our website that goes through the primitive reflexes and shows you how to utilize our devices for those particular issues. And little video clips that make it really easy. But as you can see from that little scrape up the back there, it's very quick to grab the brain's attention through vibration and the scraping process. It's a novel therapy that has not been used before we developed this. Anyway, a lot more techniques, and here's a college baseball player. He's a pitcher. And I'll tell you that these primitive reflexes and the balance and coordination work will enhance the levels of function for our athletes at all levels. If you have any questions, I would love to address those with you, Krista. And here's a little bit more about how to find us on Facebook, Instagram, on our website. And a little saying that Dr. Crayford at the Apex Brain Center sent me a note one day, and I love it, so I put it on the end of most of my presentations. He says, "Thank you for your contribution to this world. I see your invention as a musical instrument. The more I play it, the more I see its complexities and potential." And that's from a man who trains Olympic athletes that are going to be in the next Olympics and have been in our past ones. And anyway, we're happy to say that we have been down on the floor at the Olympics helping out with an awful lot of our athletes through our professionals that use our tools. Questions that you might have?
Yes, thank you so much for sharing, Sharik. I'm going to do a quick summary and then a couple of questions for you. All right. Well, first of all, thank you for sharing this excellent information and tools with us. So you talked about retraining the brain to be able to function with all structural and physical limitations that exist. And you gave us a great example, a personal example, and how you've been able to make adaptations. So you talked about cranial nerves 5 and cranial nerves number 10 being on teeter-totter. So cueing of what's happening within the brain and the body. We have the trigeminal nerve for things like clenching and feeling of the face. We have the vagus nerve, we have the dorsal and the ventral vagal complex. It goes from below the head to below the belt, communicating with so many systems in the body. For modulating inflammation, helping breathing, controlling relaxation, inhibits depression, regulates serotonin production. There's actually 3 times more afferent than efferent fibers, relays visceral afferent information to the limbic, forebrain, and cortical regions. And then the ventral vagal system is associated with things like heart rate, stomach acid, as well as vocal cords. And so because of the vocal cord connection, we can do things like humming and chanting. The vagal nerve therapy can help with so many different case presentations. To name a few, migraines, headaches, vertigo, jaw pain, TMD, concussion, ADHD, autism spectrum disorder, neck pain, sciatica, fibromyalgia, and tons more. The Rezzimax is an excellent tool for all professionals, both from Eastern as well as Western backgrounds. And with Rezzimax, it's a distinct anatomical connection using vibration calibrated with a purring range to speed up stem cell activity. And it utilizes, and you put it or apply it at acupuncture points, allowing vagus nerve efficiency and calming the nervous system. So the whole body de-stress, add humming with the device, calming song of the nervous system from the feet all the way up. And then the greatest chemical change is the mindset. So while engaging with these amazing protocols that you've shared with us, then also what you're thinking about is going to have a great impact. And you share with us the headache protocol. So starting with the tongue between the teeth and humming. The Rezzimax tuner and accessory tongs and neck pillow, those are going to be the tools that you utilize. Slowly rotate the head from side to side for 2 minutes, an intensity level of 6 with the tongs on the center of each eyebrow for 2 minutes afterwards. And then a comfortable intensity level, the tongs between the eyes at the top of the nose for 2 minutes. Increase intensity to about level 10, put the tongs under the jaw for 2 minutes. The tongs in the mouth intraorally to level 10 between the teeth and cheek for about 1 minute, moving side to side, then slowly opening and closing the mouth for about 1 minute. And then a comfortable level with the tongs at the instep of the feet for another 2 minutes. So an amazing protocol. And thank you again for sharing that great resource of heading over to your website and actually checking out the different protocols for all different kinds of case presentations. And then getting started, you could always use a vibratory tool, but recognizing that it's not calibrated at the same level as the Rezzimax. And then also the scraping technique to reestablish the body map. It wakens the body and its connections. And also primitive reflexes for integration. So scraping to integrate the reflexes, great for kids with autism spectrum disorder. Lots of different primitive reflexes, and you have some good videos for us. And then when it comes to working with people like athletes, combining Rezzimax with balance as well as coordination work to enhance and improve performance. What a wonderful presentation. Thank you so much for sharing this with us. Quick question for you. For our chronic pain patients who have perhaps become sensitized, meaning they're sore to the touch, the nervous system is overactive, what would you say it feels like when using the Rezzimax? Is it something that's relaxing? Do you feel what kind of stimulation are they feeling in addition to the vibratory sense? And what should they expect afterwards?
That's a great question, Krista. One of the things that I always tell my patients is the first thing that we've got to do with a chronic pain is change it. The brain is not going to try and heal a chronic pain. So the first thing we do is use pressure points below it or above it, send a little pain sensation. I tell them it's going to be temporary. You may have an increase in pain for about 20 seconds. Your brain is going to respond to it, and it's going to kick you into a sympathetic state very quickly, but it'll flip into a parasympathetic state because of that vagus nerve engagement. So in essence, I'll scrape at the toes for peripheral neuropathy. People tell me that have not felt their toes in years that, oh, I felt that. And I said, give it a few seconds. You'll notice that the pain will back off and you'll be left with an increase in sensation. We just had to rewire your phone lines. And I do that through pain first. So it's just a little bit of acute, fast pain so that it tells the brain to start the healing process over. And then we kick it into more and more and more healing. So there are times when that little bit of pain is super important to cue the body to start over. But I don't want it to stay in that. That's what they've been in for so long. So it may be more pain for a few seconds, and then it'll be followed by healing.
Wonderful. And you shared with us a lot of different protocols, for example, the headache protocol. Now, would you recommend patients only do this when they have a headache, or is this something they can do preventatively to prevent the headaches from coming back?
It depends on what they want. If they just want pain relief, if they just want to use it like an Advil or a Tylenol, they can, and it'll be a very successful help. If they want to learn how to stop having those headaches, they've got to break the pattern because it is a pattern once established. It's a stress response that the body goes through. Anytime that stress level builds up, the headaches cascade starts. And so we've got to break that cascade. The best way to do it is to do these techniques daily, whether you have a headache or not. That's what we did in the study. That's why, and you'll see that when it's published, why it was so effective. And for months after they stopped using it, it remained to be very effective. But the reason it was so effective is that they did it daily, whether they had a headache or not, leading up to or through a couple month period, and then they diminished it and diminished it and diminished it. So they stopped using it after 3 months, but it was enough time to break the headache for the majority of the individuals in the study.
Excellent. Breaking the pattern, retraining the brain. And as we conclude another powerful session of the Pain Summit, I want to recognize Sharik as a true health hero. And to our incredible viewers, I commend your commitment to overcoming chronic pain and prioritizing your health and well-being. I'm Dr. Krista Burns, your host of the Pain Summit. Click below for on-demand summit access, and don't miss the Advanced Chronic Pain Solutions course held exclusively for healthcare professionals to help your patients overcome chronic pain. Stay tuned, and we'll see you in the next Pain Masterclass of the Pain Summit.